Hi everyone. In this video I will be discussing a topic that I'm going to refer to as angels and demons, mental health, and psychiatry. The words angels and demons have been used in different ways throughout history. They can be used to refer to spiritual beings, spiritual entities that are unseen. They have also been applied to beings or entities that are actually physical, perhaps in some cases extraterrestrial beings who seem to have particularly positive or negative attributes. When people discuss seeing or hearing angels and demons, society has different ways of potentially reacting to that or judging or responding to it. In some cases, when people claim to be communicating with some sort of other dimensional or otherworldly entity, people look up to that. People in some way praise it or idolize it. They see it as divine inspiration or divine intervention, and they want to carefully listen to or heed what that person is saying. Various religions and cults develop in that way, where a person receives some message, some information they're sharing that appears to come from some higher source or some being from a spiritual realm. If we look at the writings in the Judeo-Christian Bible, we see that theme where someone is claiming they've received this divine communication, this so-called message from God or from the gods. And people take that very seriously. People think it's some immutable truth that has been shared that they need to listen to and follow. That's sort of one extreme way of reacting to it. Another way that people might react is what's become rather common in our modern Western civilization. People who claim to be scientifically minded or skeptics who completely discount it, who convince themselves that whomever is sharing these contacts or communications with unseen beings must be in some way mentally ill or delusional. And this brings us to the area of psychiatry, where if a person is seeing or hearing things that other people aren't able to see or hear, it's referred to as a hallucination. So people are described as having auditory hallucinations or visual hallucinations, and that's considered to be a symptom of some form of mental illness, in particular a symptom of psychosis or schizophrenia. It's interesting how these two polarized extremes of response to this phenomena have developed. In one extreme, people are overly willing to accept at face value what the person is presenting, and at the other extreme, they're wanting to completely discount the reality of that phenomenon. The more we research and explore and investigate these phenomena, the more we see there are various complexities to it and a need to find some kind of integrative or holistic way of understanding all of this. There's a considerable amount of evidence that those spiritual realms that people often discuss are quite real. There are different dimensions or layers of energy and consciousness which have a very real and essential effect upon this physical plane that we're perceiving. So the physical and spiritual realms are actually inseparable from each other. The physical reality would not exist without underlying spiritual dimensions that provide the energy, the information, and consciousness that are projected to create the physical manifestations. When a person says that they're hearing voices and the voices are telling them things, they may indeed be receiving some type of communication from a pattern of consciousness that exists in that spiritual level. People often go to see spiritual mediums and psychics, people who are acting as a professional who transmits or translates those types of messages. And it's often been demonstrated that that information is quite accurate, information that could not have been obtained through any ordinary physical plane type of communication or access. So there's something very real, something tangible that's occurring. People can label those beings or entities they're communicating with through whatever language or imagery they have within their own belief system or consciousness. So people may perceive this information as coming from spiritual guides, from deceased ancestors, from religious figures like Jesus or Buddha, or perhaps from angelic characters, archangels, beings of that nature. Whether those are the actual identities that are producing those messages or information is something that would be hard to definitively discern or prove. However, the reality of that information itself is something that often can be validated. When a person is receiving some form of message or communication from what they perceive as a non-physical being or an extraterrestrial being, or even a message that they may think is some form of mind control transmission, some form of electronic or frequency-based manipulation of their mind, when they're having those experiences, it would be wise to consider the possibility that they're honestly describing what they are subjectively experiencing. Once we are open to those possibilities, then we can more carefully assess and explore what may or may not be occurring. Often when a person is in an emotional state of some type of anxiety or fear or some type of anger or antagonism, they may bring into their consciousness either or both internal and external messages that resonate with or reinforce their emotional state. So a person who is filled with a lot of anger, a lot of antagonism, might have messages come to them about carrying out acts of violence or harm. To some extent, that might be their own internal mental dialogue, but if we understand spiritual and metaphysical principles, we could consider that they may be attracting into their field of consciousness other beings who carry a similar type of thought pattern, a similar emotional pattern. So there could be spiritual entities that are resonating at the same wavelength who are naturally drawn toward that person when that person is in that mental state. Like attracts like energy, like consciousness. So that person may be bringing toward them what spiritual teachers or spiritual practitioners would refer to as entity attachments. These are spiritual entities from the lower frequency range of the spiritual realm or astral plane that seek to interact with our physical reality to in some way influence or communicate with individuals who are incarnate here. So a person that hears voices telling them to carry out violence may indeed have those types of entity attachments, beings who are seeking to push them toward carrying out those actions. This doesn't take away that person's responsibility for their own actions, but it does give us some insight into the factors that may be fueling those behaviors. If we just ignore the reality of what that person is subjectively experiencing, we will be less able to provide help or assistance in helping them heal or resolve what they're going through. Thus, in the mental health field, it would be wise to not discount when people are saying they're having these types of experiences. We want to help them process and understand what they're going through and help them cope with their feelings, with their thoughts, and with any unpleasant experiences or traumas that they have gone through. Only by healing them on that psychological and emotional level will we produce lasting changes in their behaviors. Just temporarily trying to suppress a person's thoughts or emotions with chemicals, with brain-suppressing drugs, is not really an answer. It may temporarily stabilize their behavior. It may temporarily numb their mental or emotional state. But once the effect of that drug wears off, all of those energies, all of those emotions, all of those thoughts are still present there in their energy field, in their consciousness. So we need to really address what's there rather than trying to deny it, to cover it up, to pretend that it's not real. Throughout history, human beings have often ignored realities that are inconvenient or difficult to understand. Yet by ignoring or denying those things, we've actually given away our power and our potential. We've kind of put ourselves in a mental prison, in a box of limitation. We've allowed ourselves to be manipulated and subjugated many times as a result of maintaining these states of unawareness or ignorance. This has been a big challenge in the mental health field, since it's common to attempt to ignore the spiritual dimensions, the transpersonal and metaphysical realms. Yet most of what's happening in our lives is governed by unconscious processes. Most of our mind, so to speak, is not our conscious mind. It's those subconscious or unconscious layers, including the realms where our individual mind is not separate from the collective consciousness, from the unified field of consciousness, what we could call the infinite consciousness or divine mind. So when we tune into those deeper levels of who we are, we start to learn or understand more about ourselves about how we interact with the world around us. Part of that does involve our interactions with beings who exist in the spiritual realms. Since those beings are always there, always part of that realm or dimension, and always potentially interacting with us in either a beneficial or harmful way, it's helpful to consider what's occurring and to work with it in a way that assists us and empowers us to live our lives in a more healthy and prosperous way, and to heal any issues that may be present that may have drawn to us any of the negative spiritual influences. I hope that this discussion has provided some insight and ideas. For those that want to learn more about these subjects, I invite you to watch more of my YouTube videos and to visit my website, www.phinsights.com. Here is where I present a holistic perspective on psychology and spirituality, on health in general, not just mental, but also our physical health. And there's a lot of clinical evidence or experience that's shared, as well as empirical evidence about these topics. This isn't just idle speculation, but this is based on myself and other people having clinical experience with millions of other human beings, as well as the research that's been done on these topics: parapsychology, holistic health, alternative medicine, and so on. For now, I want to wish each of you a wonderful day. Namaste.